Good morning, and good day, everyone. Yes, James William Mugenyi is my name, a man in uniform, a medical clinic officer. I am here once more to express myself. Fellow citizens, Ugandans, I have seen we are torn apart because of death. And that's what happens when you don't address death very well. Yes, grieving. I think if you remember when we lost a member of parliament from Arua municipality, you remember what happened in Arua? They broke seats. They were violent. Yes, grieving takes several forms. I have seen Owenyi Dolo do his part, and yet he's a leader. We are now receiving tribal undertones. Fellow citizens, let us use politics to improve medicine, our health care, but do not use death. Let's not use death to make political gains. I come from a region that Henry Tumukunde one time said, how does he even settle in parliament with the people who come to parliament after barring people? Yes, in my district, in my region, you don't need a manifesto. All you need is to run to the secretariat, NRM secretariat, pick an envelope, buy a coffin and perhaps tent and chairs and bury somebody, and that is the mileage for you to parliament. Yes, I can see it's almost being replicated at parliament level. Olanya's seat, the late, yes, it is constitutional, but it has happened before. It has been happening. Yes, I come from a region that HIV is the main occupation. Fighting HIV/AIDS is the main occupation. Anyone who comes from the East, you know that. Yes, I think it is during the COVID-19 period that you people understood that truck drivers drive diseases. Some of us come from a region endowed with cement, rocks and cement, phosphate. All we see trucks coming to pick cement. But when you talk about poverty levels, poverty indicators, we are the poorest. But why are we poor? One of the things that is driving poverty in our region is HIV/AIDS. We are so devastated by HIV/AIDS. If you look at HIV/AIDS in Tororo or Eastern Uganda or Busia, that region, HIV/AIDS is as if it is in the original 1980s in Rakai. HIV/AIDS has caused destitution in my district. That parliament people who go to parliament now use death as a resource. I'm disappointed that we have gone down into fighting each other over Olanya's death, and have insisted Olanya died looking for treatment. And I think and I thought all of us now that every person big, I have seen Maika, the Prime Minister from Uganda, I have seen Owenyi Dolo, I have seen every person is making speeches. Let's concentrate and make speeches on hospitals. Yes, we are all going to die, we shall all die, but how do we die? Dying should have dignity. We are now having a member of parliament, our speaker, other than grieving, but as a nation, we are torn apart. We are torn apart. Yes, we are torn apart because there are people who are not considered in grieving. Yes, illness has has 4 Ds. We have what we call disease, we have what we call disability, we have what we call destitution, we have what we call death. Olanya's death has left us at destitution. Who has not been touched by Olanya's death? They have even brought in the Kabaka of Uganda, and that's what we call destitution. If you don't handle death well, which the medics know, I am sure you have seen how Chief Justice doesn't know how to grieve. He has embarrassed himself as a Chief Justice. He doesn't know how to grieve. But me as a medic, I understand he's grieving. He's grieving. But then at his level, in medicine, we have what we call the ability to control emotions. Have you ever seen a doctor or a nurse crying with you? No, they don't, because we are trained to control emotions. So we expect maybe somebody should have handled Chief Justice early enough knowing that this is sensitive. He should not have come out even to speak, perhaps. But fellow citizens, let's address our medical conditions in Uganda. Some of us who are speaking are medics from Uganda. Why am I speaking from America? And now people even end up threatening me. Why do you threaten a man who is facing COVID-19? Do I need to fear anymore? A man who is facing COVID-19, I have more fear being overseas in this COVID-19. Who doesn't know about COVID-19 in America? Yes, Parliament should not be used to divide populations. Parliament should be used to establish values that populations must follow. We are a grieving nation, but are we? I salute you, Ugandans. Thank you.